Welcome to the She Found Motherhood podcast. So you're pregnant? Now what? Well, if you're a loyal podcast listener, then you've listened to our episode about choosing a care provider. So you've got that sorted out and your first appointment booked. But now what?
Generally speaking, as maternity care providers, we like to see you anywhere between your 6th and 9th week of pregnancy for your first visit. If you're experiencing significant nausea or other concerning symptoms, then by all means, reach out to your provider and let them know your concerns. Many times they will be able to squeeze you in sooner, even if just for a quick visit to help get you feeling better or address your concerns. Now, if you have a family doctor, sometimes they can help you manage these symptoms as well, so check in with them as well. We'll get into it right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
So, your first prenatal visit. What to expect? Questions from us. Lots and lots of questions. And don't worry, there'll be lots of answers for your questions too. It will be a long appointment, anywhere from 30 minutes or longer, depending on the complexity of your medical and pregnancy history. Many clinics will have a handout for patients to complete to gather some of the information required to complete your pregnancy record, otherwise referred to as your antenatal record.
What kind of questions will we ask, you might be wondering? We typically start with the basic questions, just getting to know you and your partner, if you have one. We'll collect some information about your ages, what you do for work, and if you have any particular beliefs that will impact your care, or that you feel is important for us to know about. Then we'll move on to gather some pregnancy history. So this includes any pregnancies that you've had in the past, regardless if they've resulted in a loss or you've had a termination or a birth. If you've had a loss or a termination, it's important for us to know if there were any surgeries involved. If you've been pregnant before, we'll want to know specific details about how the pregnancy went, including any complications in the pregnancy like high blood pressure, diabetes, etc. We'll also ask you lots of questions around the birth. If you went into labor on your own or if you were induced, how close to your due date were you when baby was born? If you had a spontaneous vaginal delivery, needed an assisted vaginal delivery like a vacuum or forceps, or a cesarean birth, and the reasons behind that. And if you had an assisted birth or a cesarean section, we'll want to learn more about that and why as well. So was there an abnormal fetal heart rate? Did your cervix not dilate? We also like to know information about after the birth experience. So were there any complications with bleeding or infections? Did your newborn need any support after birth? Did the feeding journey go okay? Did they have any problems with jaundice? Those types of things.
And if you've had multiple pregnancies, then we'll ask these questions and details about each pregnancy. We know that's a lot of information, but it really helps us when we're answering your questions throughout your pregnancy and also helps us providing you the best care that we can. We'll also gather some information about how this pregnancy has gone so far, starting with information about how the pregnancy was conceived. Was it spontaneous, or were there any reproductive technologies like IUI or IVF involved? We like to know if you're having pregnancy symptoms, including nausea, if you've had any bleeding or pain. We also like to know if you've had vaccinations, including the flu shot and the COVID vaccine.
Then we'll ask you some information about your own personal medical history. We'll review any medications that you're taking, including prescription medications, supplements, or over-the-counter medications. We also want to know if you have any allergies to medications, food, or environment. In terms of your medical history, we'll review if you've had any surgeries, in particular, any abdominal surgeries, uterine surgeries, or cervical surgeries, and if so, what were they, when, and why? We'll take note if you've had any anesthetic before, and if you experienced any difficulties because of it. It's important for us to know about your sexual health history as well, including if your cervical cancer screening, i.e. the Pap test, is up to date, if you've had any previous sexually transmitted infections such as chlamydia, gonorrhea, herpes, syphilis, HIV, hepatitis.
We'll then review your medical history, including any cardiac or respiratory issues like high blood pressure, asthma, etc. Any gastrointestinal diseases like celiac disease, Crohn's, colitis, irritable bowel, any endocrine disorders like thyroid or diabetes, any genitourinary like history of kidney stones, kidney or bladder infections, any underlying neurological disorders, history of migraines, seizures, etc. We also want to know if you've ever had chicken pox. This one you might need to ask your parents about. We'll also review your mental health history, including any history of depression, anxiety, bipolar, PTSD, ADHD, etc.
Phew, that is a lot
Mhm.
of information.
Mhm.
So, we've covered what information we need to gather about your medical history, including medications, pregnancy history, sexual health history, medical and surgical history. Next, we'll pivot and gather a little bit of family history. Now, pregnancy is unique, as much of the family history that we need comes from the maternal family, or rather the gestational carrier's family. Specific conditions we'll ask about with respect to family history include heart disease, high blood pressure, diabetes, mental health history, problematic alcohol or substance use, or history of bleeding or bleeding disorders or blood clots. In terms of a family history for both the parents, we include history of diseases, inherited diseases or differences such as cystic fibrosis, muscular dystrophy, sickle cell anemia, etc. We often say to our patients, if you haven't heard of these diseases, then they probably don't
Mhm.
run in your family.
Okay, so we've covered the personal and family medical history we gather. You'd think that would be enough, but it is not. We love to know everything we can to support you to have a healthy pregnancy. So, what else do we want to learn about? We'd like to learn a little bit about your dietary habits. Do you have any food restrictions or specific dietary practices you follow, like vegan, vegetarian, paleo, etc.? This can help us understand your nutritional intake and if additional support through a nutritionist would be helpful to optimize your nutrition in pregnancy. We also again review what over the counter medications, vitamins, and supplements you may be taking, as not all may be recommended in pregnancy.
We also talk about your physical activity habits and how you stay active. It's so important to stay active in pregnancy. And if you haven't been active, it's definitely okay to become active in pregnancy. We recommend you connect with your care provider about specific activities and any questions you might have. We also gather information about your substance use history, when your last use of alcohol was, if you do use alcohol, whether you have a history of recent or remote use of additional substances such as nicotine, opioids, stimulants, or cannabis. This helps us understand where you come from and what additional supports, if any, we might be able to connect you with during your pregnancy.
Lastly, we always ask you about your social supports. Who's going to help support you in pregnancy and postpartum? Is your housing stable? And do you have any concerns about domestic violence or intimate partner violence? So that's it for questions. It often takes a good amount of time to work through these questions. And as we walk through them, we often end up answering many of the questions that you might have had coming into your first visit.
But it doesn't end there. After gathering the history, we'll talk a little bit about what investigations we like to order at your first visit. So these include laboratory tests, aka blood work, and a dating ultrasound. For your first prenatal, we order lab work to investigate any conditions that could impact a pregnancy. We look at your blood count and check your iron levels and your B12 levels. We check your urine to make sure you don't have an infection, either of the bladder or chlamydia or gonorrhea. We check your blood sugar levels, your thyroid hormone levels as well. We do a screen for infectious diseases for anything that may impact your pregnancy or your newborn baby, including HIV, hepatitis B, hepatitis C, and syphilis. Additionally, we check your immunity to viruses that, if you were to get infected with during pregnancy, can put your pregnancy at risk. These include rubella or German measles, parvovirus, slat cheek disease or fifth disease it's known as, and varicella or chickenpox. Then, last but not least, we also check your blood type. And if you want to learn more about your blood type, you can listen to our podcast all about understanding your blood type and why it matters in pregnancy.
So that's the basic lab work. And it may be if you have an underlying medical condition, there could be additional blood work required. We also get a dating ultrasound. This is now the standard of practice here in British Columbia, where we practice. Doing so confirms the viability, aka it confirms your little peanut is growing safely inside you, and it also confirms your due date, as oftentimes measuring the crown rump length, the CRL, is more accurate than using your last menstrual period. The dating ultrasound also helps us be certain of your due date, so if you decide to proceed with genetic testing, we're using the most accurate gestational age when submitting your testing. Genetic testing is a complex discussion and one we're not going to get into here, but fear not, we've got another podcast about that, and you can learn more if you have a listen.
We also cover this in a bit more detail in our Pregnancy to Parenthood
Yes.
podcast series. So if you're interested in getting a week-by-week podcast series that gives you all of the information you need to know as you need to know it, make sure to check that out on our website. It's a pretty reasonable price for a whole ton of information.
Mhm.
So that's what we cover in your first prenatal visit. It's really a comprehensive visit where we gather as much information about you as we can to provide the best care so that we can optimize your pregnancy health and well-being. It's also a great opportunity for us to answer any questions you might have for us about early pregnancy and your pregnancy care. We'd recommend you head on over to our show notes and download our newly pregnant must-dos handout linked below in the show notes. We've also created a handout that you can fill out and bring into your care provider if they don't have their own one as well, just so you can take your time to make sure that you get all the information that your care provider might ask you about at your first prenatal. So make sure we'll link that in the show notes that you go ahead and download that as well. And as always, stay tuned for our next episode where we'll cover routine pregnancy care and what to expect.
Thanks for listening.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.